Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us once again for Health Professional Radio. We'll be speaking with Shubh Goel. She's joining us here as VP, Head of Immuno-Oncology and GI Tumors franchise at AstraZeneca to talk about some data that was presented at the European Society for Medical Oncology 2023 from the MATTERHORN Phase 3 trial data. Welcome to Health Professional Radio, Shubh Goel. Thank you.
Thank you, Neil.
Tell us briefly a bit about yourself, and then let's jump right into the significance of the MATTERHORN Phase 3.
Sure. My name's Shubh. I'm, as you mentioned, the Vice President and the Head of our Immuno-Oncology franchise and GI Tumors here in the U.S. for AstraZeneca. And we're super excited to talk to you about the MATTERHORN study today. The MATTERHORN study was conducted in resectable early stage or locally advanced gastric and gastroesophageal junction cancers. So, a form of gastric cancer. Disease recurrence after the curative intent surgery is really common in this setting. These results from the neoadjuvant component, so the component of therapy before surgery from this phase 3 study show really encouraging pathologic complete responses, or PCRs as they're referred to. What we saw in the study was that the neoadjuvant IMFINZI plus chemotherapy more than doubled the PCR rate from 7% to 19% in the resectable early-stage gastric and GEJ cancers versus neoadjuvant chemotherapy alone. And the complete or near complete response was 27% versus 14%. So, really interesting response rates. We saw that the safety signal was generally tolerable with no new safety signals in the neoadjuvant setting. And we're further kind of following this study in terms of ongoing endpoints, but, interesting data in this first output.
Let's talk briefly about the current treatment landscape for GEJ cancers.
Yeah, so the current landscape for these cancers it's generally considered curable, but there's still a great unmet medical need because disease recurrence is really common. And, just to give you a sense of that, about 25% of patients will recur after 1 year. For these patients, they may also receive perioperative chemotherapy, so before and after surgery. MATTERHORN is looking at the addition of IMFINZI to standard of care chemotherapy in this perioperative setting. So looking at IMFINZI plus chemotherapy before surgery and then IMFINZI after surgery.
What's the prevalence of these juncture cancers in the first place, and what do the positive results from this MATTERHORN study indicate for patients and the medical community at large?
Yeah, Neil, there is a high unmet medical need in this space with these gastric cancers. There's an estimated 26,500 new cases of gastric cancer in the U.S. in 2023, and about 127 or more than 127,000 people living with gastric cancer in the U.S. in 2020. Disease recurrence is really common in these patients with resectable gastric cancer, so with gastric cancer that is removable with surgery. There is still recurrence. Approximately 1 in 4 patients recur within 1 year after having that surgery. So there is an urgent need for more treatment options. The results from this MATTERHORN study highlight the potential of early treatment in this setting using IO in combination with chemotherapy, with the standard of care chemotherapy that patients are getting today. This trial will continue to assess the primary endpoint of event-free survival and a key secondary endpoint of overall survival after surgery as well. So we'll see kind of the longer-term outcomes in the future, but really interesting results from the neoadjuvant setting only in terms of improving responses.
How else is AstraZeneca studying the use of immunotherapy in these cancers?
Yes, that's a really great question. There's significant unmet need across GI cancers, and I'm sure you're aware, GI cancers represents, quite a number of different cancer types. IMFINZI is actually approved for 2 other GI cancers late last year, biliary tract cancers, which includes cholangiocarcinomas and unresectable HCC. MATTERHORN is part of our larger development program for the treatment of GI cancers, and this one is our first study in the gastric cancer space. We also have ongoing studies in earlier HCC, in intermediate and adjuvant settings. So again, similar setting after surgery to the MATTERHORN study. HCC is a common type of liver cancer and the third leading cause of cancer death worldwide. And then we also have another study called Kunlun in locally advanced unresectable esophageal squamous cell carcinoma. So again, sort of a step further along the pathway for those GEJ cancers after where the MATTERHORN study may fit in. So that's just the beginning. We have an ongoing pipeline of an area of focus for GI cancers, and we really hope to make a difference across the paradigm of GI cancers here with IMFINZI or IO therapies in general.
You mentioned your GI pipeline. Are there any specifics, any goals that we should be looking for as far as AstraZeneca is concerned?
For the rest of the pipeline, it's early days. We are really excited about what we have coming, in the next wave of immunotherapy agents with our bispecifics. Mm-hmm. We're looking at, where they may fit in and help patients across the GI tumor paradigm. And, across oncology, not just GI, we have a goal of really, affecting cancer outcomes across the board, reducing the effects of chemotherapy, and potentially with the ability of combining different modalities from across our own portfolio. So I'm super excited to be here at AstraZeneca with the potential of not just in the near term with, outcomes for patients from studies like MATTERHORN, but also the future in terms of continuing to change the treatment paradigm and expectations for outcomes from both efficacy and safety for patients across GI cancers.
Obviously, you're personally connected to this work. Why are you personally passionate about the work that AstraZeneca is doing in GI cancers?
Most importantly, I'm really, I think we're committed to improving survival in the most difficult to treat cancers where there is a high unmet medical need. And we're seeing this, as I mentioned, with some of our earlier indications that happened earlier this year. We continue to explore patient types and cancers where there is that high unmet medical need. And I'm really passionate about kind of seeing the output of those studies and bringing those results to patients and their caregivers so that we can make a difference and really affect change in the cancer world.
Well, I do appreciate you joining us here on Health Professional Radio this morning. Lots of great information. Hopefully you return.
Thank you so much, Neil. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Shubh Goel. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.